is Dr. Angeline Joseph Shillingford, and we're going to be discussing Descartes, the father of rationalism. We're going to be taking a look at Rene Descartes. We'll be looking at the theorist's background in terms of his early life and his education and academic career. We'll also be looking at his major theory and how this philosophy came about and what are some of the concept limitations. We will then be looking at the ethical considerations of the application of his major theory before we discuss how application of his theory can enhance practice and lead to better outcomes for our patients. So let's look first of all at the early life of Rene Descartes. So the philosopher and father of rationalism, Rene Descartes, was born on the 31st of March in 1596 in the town of Le Haye in Touraine in France. His childhood was marked with trauma from an early age, and his mother passed away just after his birth, and his father, Joachim Descartes, was mainly absent from the home. He actually worked in one of the provincial parliaments as a council member. This resulted in Descartes being raised with his siblings by their grandmother. Descartes studied several subjects at the Jesuit College of La Fleche. These subjects included mathematics, ethics, languages, physics, and metaphysics. He then got his law degree in 1616 from the University of Poitiers. The study of these subjects were influential in his development of his philosophy theories in the years to come. So his focus on science and philosophy in his academic career was likely influenced by the importance of education that his family emphasized and encouraged. It is purported that Descartes based the tenets of his career and philosophical theories on reasoning and introspection that was likely influenced by the absence of both of his parents. Rationalism, Descartes' major theory, emphasizes the role of reason and the role of introspection in the acquisition of knowledge. Whereas his other major theory, methodological skepticism, focuses on using pure reasoning to reach truth. This approach of doubting sensory experiences was captured in the famous paper Meditations on First Philosophy. The rationalistic approach of philosophy has been applied to mental health in a variety of ways. This includes the promotion of self-awareness and the application of cognitive processes. These cognitive processes pave the way for medicine and behavioral health to align, with the focus on mind-body dualism that encompasses beliefs and patterns. These concepts, by focusing on consciousness and self, aligned culturally and physiologically with the enlightened values that included individualism and reason. There were several limitations to his concepts, which included not considering how a client's environmental factors and sensory experiences might impact and influence a client's behavior and well-being. This might result in the intertwined relationship between the environment and mental and physical health not being fully considered by a therapist, or a mental health professional. When considering the impact of rationalism, the ethical implications should be taken into account as well. There may be a biased view of partial diagnosis or consideration if sensory experiences or empirical evidence are not taken into account, or result in those with mental health disorders not fitting in to the rationalist framework. Ethically, focusing on reason alone may not result in diverse perspectives being considered, which could exclude critical elements. When considering the ethical implications of rationalism, it is important that we consider the core principles of this particular theory. These core principles include introspection and reason. So introspection and reason integrated into professional techniques does have ethical implications. There are also ethical implications of focusing on fostering self-awareness and critical evaluation in terms of skills that are taught to clients as part of their therapy. But to truly understand the ethical implications of rationalism, it's important for a personal reflection to occur so that I, as a proposed mental health practitioner, can see how personal alignment will affect the application of rationalism in an ethical environment. So I have personally reflected on how rationalism and Descartes' philosophies could influence my own practice. In my own practice, I will endeavor to ensure that introspection and reason are incorporated into the techniques that I adopt because of the benefits that I perceive that they will have. I am interested in developing the skills of self-awareness and critical evaluation for my clients. I am also drawn to the focus on evidence-based research, interventions, and validation tools at an empirical level, as this is in line with my own temperament and methodologies. I believe that by incorporating key components of rationalism, I can elevate my own practice and secure better outcomes for my patients. However, I do understand that the limitations of rationalism can affect the way that I do deliver my own particular style and brand of therapy in the patients that I will see. So by incorporating introspection and reasoning into my professional techniques, I need to ensure that I am not doing that to the detriment of other forms of therapy that focus on different tenets of psychology. I also need to consider how enhancing practice can occur through the application of rationalism. So patient outcomes can be delivered if incorporation of rationalism is taken on board by looking at the key components that can improve patient care. This would include aligning techniques to make sure that better mental health results can occur for my clients. In terms of broader impact, I need to consider, or all of us as practitioners need to consider, how we can elevate our practice through structured reasoning and empirical focus. We also need to consider how we can strengthen our therapeutic interventions for lasting success for our clients. So, in conclusion, we have looked at the life and work of Rene Descartes, considered the father of rationalism. We've looked at the background influences of his childhood, of his trauma, early trauma, his upbringing that influenced the tenets of the philosophy that he developed. We looked at how the major influences on his life affected how he put together rationalism as a theory. We were also then able to look at the ethical applications of this theory into practice, as well as looking at how clinical practice was able to be enhanced by the application of rationalism. So, as we reflect on the life and learning of René Descartes, the father of rationalism, let us consider one of his most famous quotes, "I think, therefore I am," which sums up the major principles of his major theory of rationalism and which can be applied today in our own clinical practice as we seek to improve patient outcomes for better mental health for our clients.